Hello, and welcome to Facebook Live with Dr. Brie. I'm coming to you today with some important topics, primarily reviewing the M Factor 2 film, which we had at our Pause Pod event recently. It was awesome. And I wanted to provide some insight from the movie, some reflections, but specifically, one of our members asked, can you talk about what my partner needs to know in perimenopause? And I want to use that lens to frame some of the information in the movie because the movie is really about perimenopause, not about menopause itself. And I think when we talk about menopause, many people now are thinking about, hot flashes and period changes or your period stopping altogether. And that is menopause. And we can have and have had many conversations around that. I think it's important to understand in perimenopause, there's some nuances and some really important differences. And as a partnership, if you don't recognize the signs, they can start to feel like there's a problem in your partnership or your relationship. And many times in the background, there's hormone changes that are at play that we can't see because our periods may not be changing yet, and hot flashes may not be that primary symptom. So I love in the M Factor 2 film how they start off with something we see all the time in the clinic, a really common presenting symptom, not feeling like myself. Not feeling like myself. There are so many women in midlife who, they go through the the hoops and they get to, through their education, and then they get into their childbearing years if they are doing that, or their partnership and their work life, and their, kicking butt and taking names, and hit mid 40s, sometimes late 30s, and feel different, like not the same as they used to feel. More exhausted, more emotional and mental fatigue were highlighted in the movie, and just not feeling like myself anymore. And I love that they called that out in the movie because that's probably the number one thing I hear when we start people on hormones and we're, on the other side of it, and people say, "Oh my gosh, I feel like myself again." There are other subtle signs that happen in early perimenopause. Early menopause transition is technically defined by the Menopause Society as greater than 7-day change in your cycle. So 1 month it's 21 days and 1 month it's 30, right? So that's greater than 7 days from the first day of your menstrual cycle to the next first day. So the, day number one being number one that you bleed, and then all the way through till that period's over and you start again. So if there's a greater than 7-day variation there, that is the early menopause transition. The late menopause transition is defined as greater than 60 days. So in variation of cycle length, this is a primary kind of cardinal, sign, if you will. And that's like dropping whole cycles, right? Having a couple of periods a year. That is a different phase than what we're talking about in perimenopause. The early menopause transition, some of the earliest signs might be joint pain. That joint pain that comes in the luteal phase right before your period, they were trying to sleep and your knees hurt, both knees all of a sudden. You didn't just suddenly get a knee injury. Estrogen is a lubricator. It lubricates all of your joints as well as your vagina and other mucosal linings, including your nose. So, joint pain in the middle of the night that just comes right before your period, that could be hormone changes. And it's actually called arthralgia of menopause. There is insomnia, waking up at 2 or 3 in the morning before you would go to the bathroom maybe and fall back to sleep, and no longer. Perimenopause, ruminating brains. In fact, in the movie, they talked about 20 to 40% of women will have a mood disorder diagnosed in perimenopause. 40 to 50% of women will have a decrease in libido or sex drive. Many women will have a new onset anxiety out of nowhere that they didn't even have before. Body composition changes, working harder for the same body that you used to have, or gaining weight without meaning to at all, without any changes in your activity or your intake. In fact, many women are trying harder and they are just maintaining with the efforts that used to help them lose weight. So these are the changes that people feel in early perimenopause before it's obvious that the hormones are at cause. And of course, there are other causes. You know that I am not your doctor, or maybe I am your doctor, and then you should come see me and talk about your specific symptoms. But it's important to know what to look for. And unfortunately, there's all these overlapping causes: burnout, fatigue, chronic cortisol. Insomnia for years and years on its own can create a lot of these same symptoms, as well as thyroid changes. So, you have to really have somebody that you can work with to kind of parse out these symptoms. But the first step in a partnership is to know what to look for and to not take it personally. So in the movie, they do a great job in the M Factor 2 film, having a men's group that they video, and their men are talking about the changes in their partnerships during this era and what they have noticed. And what they are talking about is so true and so great. There's a couple of quotes. One is, what you did in the past might not work anymore. And that might be in the relationship, emotionally, but it also may be sexually. Women change, the pH changes. That sets women up to be less acidic, which is the natural vaginal flora. It thrives in an acidic environment. So as soon as women have pH changes or less frequent intercourse, in a male-female situation, men are basic. So as women become more basic in perimenopause with the added sexual activity of being more basic, we can have vaginitis, yeast infections, and even an increase in UTIs. You may never have had a urinary tract infection in your partner after sex, and now it's every time. And that can happen. So women have changes that we have to be aware of. A decrease in sensation is another change, and that can be cyclically based if women are still cycling. Also, many, many, many great educational articles, books on the difference between responsive and spontaneous sexual desire, a whole nother topic. But important to remember here that over time, many women and men sometimes lose spontaneous desire, where you're just thinking about it. It just pops into your mind like, that sounds like a good idea. Many women move into a phase in midlife of a responsive desire, meaning that if the dishes are done and the stress is at bay, and I can pause for enough time to think about it and get back into my body and feel my body connected to my partner, I might wake up and think, wow, sex actually sounds like a good idea. And if I actually get into that place, I might really enjoy it, right? But for many people, that's a multi-step process. It's just not a spontaneous bloom of excitement and activity and desire. So oftentimes I see couples close this chapter. And when it closes, I see many couples kind of dance around the conversation of, well, that chapter seems closed and I'm not really sure. They don't seem really into it anymore. So we're not doing it. And we're also not talking about not doing it. And many times I see partners on either side, because we see men and women in midlife that want to make a change in that connection and want to get back to that type of connection in the relationship, but they don't know how to come together, which is the title of my favorite book about this topic by Emily Nagoski. I'll put it in the comments. So what can you do? The most important thing is to just ask, what's going on? I miss connecting. Could we go on a date? Something, what can I do to help lower the stress so that we can have some time that we can carve in for the two of us to connect again? Something like that. Open communication, asking, listening, not judging and blaming, not taking it personally, and recognizing, again, like the movie says, what you did in the past might not work anymore. And you might need to have that vulnerable trust and open communication about what is working for you today, in this moment, at this time, to reconnect. I think it's important to recognize there's no single home run on libido and on sexual activity. There can be a whole host of tools in our toolbox that we use, and it's really good to work with somebody who knows how to help. But I love in the movie how they talk about how testosterone is the salt in the HRT soup. I love that because, of course, at our practice, we love testosterone. We think it's a great tool. Many times the Menopause Society shies away from recommending testosterone for women because there is no FDA-approved testosterone for women. So, the M Factor doctors, many of them interviewed, work with the Menopause Society. And, the party line is that we can't really recommend or prescribe testosterone for women, though we know it's helpful because there's no FDA approved version. If you're going to, you can use this and that, option. But the fact that they highlighted testosterone as the salt in the soup, I mean, you've had soup without salt. It's not very good. I thought that was great. I love that. They also talk in the movie about having a lower threshold to start estrogen, recognizing that a lot of these symptoms we've talked about are in the background fluctuating estrogen levels. And that, before, I think there was this thought, because estrogen was, seemed as dangerous, that it's like, don't start estrogen until you really can't stand your symptoms anymore, and that there's no other treatment options, and your back is against the wall and you're like, uncle, estrogen, right? That's kind of what I was trained under, that paradigm after the Women's Health Initiative. And in the movie, they really tried to demystify that yet again, that we should all have a lower threshold for prescribing and starting estrogen, because it protects cognitive health. There's some really good brain benefits as well as bone benefits. About 20% of women lose about 20% of their bone density during the menopause transition, and estrogen is protective. But the really important thing to remember, that's also highlighted in the M Factor film too, is that the training gap still is present. So let's say you and your partner are realizing, wow, okay, this isn't about us. Maybe you're, I like to use the word stabby, a little stabby sometimes. And in that week before somebody's period, they may, sometimes people feel like, everything I used to say yes to, I now need to say no to, and I'm angry, and I'm mad, and I'm stabby, and that may be a presenting symptom. So maybe don't mention it, and then kind of find the right time to start having this conversation and opening up the conversation, because it's probably not about you and your partner. It's not about them either. It's this underlying thing that we've got to work on together, right? We've got to, as a team, have a teamwork approach to this new era. And it might be easy to say, well, just go get hormones. Maybe it's your hormones. Go talk to somebody, get some hormones. That's not so easy. Only 31% of OBGYN residency programs in 2024 to 2025 had a dedicated menopause curriculum. 31% of the women's health doctors have the curriculum to train people how to prescribe hormones. In fact, in that same amount of time, 2024 to 2025, across family medicine, internal medicine, and OBGYN residencies, only 10% of the graduating residents felt prepared to treat menopause after they graduated. So here's the trouble, right? Doctors, we are trained to think of the worst case scenario and try to prevent it or treat it. That is how Western medicine works. I'm always talking about our white horse. We want to come in on our white horse in our shining armor, and we're like, we are here to rescue you from the problem. And when it comes to hormones, many of us were taught that hormones were dangerous and bad, and they're not. Spoiler alert, okay? Depends on the type of hormone that you get and the delivery method, whether it's transdermal or cream or oral. They all have different actions, side effects, and effects. Now, of course, in the Instagram era, estrogen has no problems and no longer has any side effects at all. So our pendulum is swinging yet again. But every tool that we use in our toolbox has pros and cons, right? Every tool has effects and then side effects. So we have to look at those tools mindfully. But doctors are always going to think, well, if it's dangerous and there's another way, let's talk about another way. So many women who go to the doctor in these early symptoms today that we discuss, mood changes, sleep changes, sexual health changes, joint pain, weight changes, they're going to come out of that visit that is rushed, that the doctor doesn't feel confident or trained well in evaluating and taking the time to dive in. So they might come out with an antidepressant or sleep medication. Or have you thought about counseling? Maybe you and your partner should go to counseling. Maybe they've been told to lose weight or exercise or go to physical therapy for their joint pain. When a traditional medical practice with limited time and reimbursement initiatives around just billing the heck out of insurance and getting out of there and moving on as quick as possible, the nuances of individual variation in hormones and symptoms and response to therapy is missed. So that's why we have a membership option. That's why we have a deeper dive with all of our programs and our personalized health assessments and our healthy hormones program. Not everybody has opportunity for that. Some people turn to the online clinics, and those are nice for access, but they're very formulaic. They're very algorithmic. Every person who comes in is going to get this, right? And sometimes that works for people. Sometimes it doesn't, right? Unknowingly, we can turn it back on the patient in those encounters like it's all your fault. And women walk away thinking, oh my gosh, this is all me. Or maybe it's my relationship. Or maybe I do need a divorce. Or maybe I do need a major change, right? When in the background, these fluctuating hormones and our cortisol and our sleep, they all kind of come together. And somebody like us can help you to understand the bigger picture and to figure out what is right for me at this time in this transition. Do I need more sleep? Do I need more exercise? Do I need more connecting time with my partner? Do I need estrogen? Right? Do I need all of the above? And we are so adaptable as humans. We will adapt to a new normal over and over again. And my recommendation in a partnership is that you learn to find the pleasure in life together again. Whatever that pleasure is, the little pleasures, the big pleasures, carving out the time, right? My best friend's grandmother said when my best friend was getting married, and I had, her grandmother to look up to for a long, long marriage. And I said to her, what is the key to a long, healthy marriage? And she said, oh, well, every 10 years, everything changes. Your body changes, your mind changes, your life changes, your priorities change, and you have to be with somebody that you can constantly change with. That rings true here too. So next time on June 17th, we're going to talk all about testing and taking a deeper dive into hormones with advanced testing, basic testing, the pitfalls, the considerations on June 17th at 12:45. So come on back and have a great day.